All right, today we're going to play detective. We're diving into a real medical mystery that takes a sharp eye and some serious deduction skills: bone tumors. Now, I want you to think of this less like a dry textbook chapter and more like a crime scene investigation. The clues are hiding in the patient's story, on their body, and deep inside the bones themselves. So, let's get started.
And make no mistake, the stakes in this mystery are incredibly high. Bone tumors aren't super common, but if a diagnosis is missed or delayed, the consequences can be, well, catastrophic. That's why the investigators, the doctors in this case, they rely on something called a triple correlation. They have to line up three key pieces of evidence. First, the patient's history, then the story the x-rays are telling, and finally the proof from a biopsy. You gotta build an airtight case before you can deliver that final verdict.
At the absolute heart of this whole investigation is one huge question. Are we dealing with something harmless, what we call benign, or is this something dangerous and malignant? Getting this one thing right from the get-go, changes the entire case.
So how do you tell the good guys from the bad guys? Well, think of benign tumors kind of like quiet neighbors. They grow slowly, they pretty much keep to themselves in one spot, and they have these really clear, well-defined borders. Malignant tumors? Totally different story. They are aggressive invaders. They grow fast, they're invasive, and, this is the most dangerous part, they have what's called metastatic potential. That means they can pack up and spread to totally different parts of the body.
Now check this out. This table gives us a really key insight for our investigation. A tumor's personality, if you will, is often directly tied to where it comes from. Whether it starts in bone-forming tissue, cartilage-forming tissue, or right from the marrow, each one has its own typical benign and malignant version. Understanding this origin story is huge. It helps doctors predict how it's going to behave and figure out the right way to handle it. Every good investigation, and I mean every single one, doesn't start with high-tech gadgets. It starts with just listening. The first and honestly the most important clues come straight from what the patient tells you and from a simple physical exam. And right away you can see two classic profiles emerge. On one hand, you have the benign profile. This is often a slow-growing lump that's maybe been there for years, causing some mild pain, maybe only when you're active. Now contrast that with the malignant profile, a mass that's growing fast, severe pain that just doesn't quit, and even body-wide symptoms like losing weight without trying or having a fever. I mean, the stories they tell are just worlds apart. Okay, of all the clues a patient can give you, there's one that stands out as a massive, flashing, neon red flag, and that is night pain. We're not talking about a little ache here. This is a severe, deep, persistent pain that literally wakes you up from a dead sleep and doesn't get better if you rest. When a patient says they have this, every single alarm bell in a doctor's head should be going off. So we've got the initial story, now the investigation moves to the forensics lab, or, in our case, the radiology department. It's time to actually look inside the bone and see what the hard evidence tells us. On an x-ray, the border of a lesion can tell you almost everything you need to know. Look at the image on the left. See that sharp white line around it? That's called a sclerotic rim. That's literally the body's way of saying, okay, I see this thing, I don't like it, but I've got it walled off. Now, look at the one on the right. That malignant lesion has what we call a wide zone of transition. It's blurry, it's messy, it's indistinct. That's the sign of a chaotic battlefield where the tumor is actively sneaking its way into healthy bone.
Okay, so if that blurry border is our first sign of trouble, what are the other really aggressive patterns that tell us this is serious and the clock is ticking?
First up on our aggression index is something called the permeative pattern. See how it looks like a bunch of tiny little holes have been drilled through the bone, almost like a piece of wood that's been eaten by moths? This tells us the tumor isn't just sitting in one place, it's spreading like a web, rapidly infiltrating the very structure of the bone itself.
The next sign is just as serious: a cortical breach. The cortex is that hard outer wall of the bone. Think of it like a fortress wall. A breach means the tumor has broken containment. It has literally punched a hole right through that wall and is no longer stuck inside. And then you see these dramatic distress signals where the bone itself is fighting back. The sunburst pattern and Codman's triangle, that's not actually the tumor. That's the bone in a total panic, desperately trying to build new layers to wall off an invader that's just growing way too fast to keep up with. It's a sign of a really aggressive fight. And finally, the clue that tells you the tumor has well and truly escaped: a soft tissue mass. This is clear-cut evidence that the tumor is now growing into the muscles and other tissues around the bone. It's a huge indicator that it has spread.
All right, with all our forensic evidence in hand, it's time to start profiling the suspects. We're going to look at the usual culprits, the bad guys we expect to see, and, just as importantly, we're going to look at the imposters that can throw the whole investigation off track.
So here we have our malignant triad, the 3 most wanted. First up, osteosarcoma. It's the most common one. You often see it in teenagers, and it has that classic sunburst reaction we just talked about. Next is Ewing sarcoma, another one seen in kids and teens, and this one can be tricky because it can mimic an infection with stuff like fever. And last we have chondrous sarcoma, which grows slower but is super destructive, and you usually see it in middle-aged adults.
But here's where our detective story gets a plot twist. Because sometimes a lesion can show all those aggressive signs we just went through, but it's not cancer at all. Yep, you gotta meet the mimics. On the left, that's fibrous dysplasia, which is just a disorder where bone gets replaced by fibrous tissue. And on the right, that's osteomyelitis, a bone infection. Now look really closely at that infection. It causes bone to get destroyed and creates reactions that can look terrifyingly similar to a malignant tumor. This is where the real detective work comes in, looking for other clues like a fever or an open wound to tell these imposters apart from the real criminals. Okay, so after looking at all the evidence, from the patient's story to what the x-rays show, how do we finally get to the verdict? Well, it all comes down to recognizing those definitive red flags and having a very clear action plan. And this brings us to the most critical checklist of our entire investigation. These are the absolute must-not-miss signs. That relentless night pain we talked about, any mass that's growing quickly, those unexplained symptoms like a fever or weight loss, and a history of pathological fractures. That's when a bone breaks from a tiny injury that shouldn't have been nearly enough to cause it. These are totally non-negotiable.
So if any of those red flags pop up, the action plan is simple and it's crystal clear. Step 1, get an x-ray. If that looks at all suspicious, the next step is an MRI, which is the gold standard for seeing the full picture. And most importantly, this has to be followed by an early referral to a specialist, an orthopedic oncologist. The key here is to follow these steps in order and not just jump to removing a suspicious mass without a full workup first. And that really brings us to the most important takeaway from this whole thing. In the end, it doesn't matter if you're a doctor or if you're a patient speaking up for yourself, your ability to recognize these suspicious features, that is the patient's absolute best hope for a good outcome. That knowledge is the first and it's the most powerful line of defense.